Hi, my name is Rakesh Popat. I'm a haematologist and associate professor at University College London in the UK, and I'm here at EHA 2025, and I'm presenting some real-world data with the use of Teclistamab for patients with relapsed myeloma. So Teclistamab is a bispecific antibody which targets BCMA, which is a target that we see on myeloma cells, and it also hits a target on the immune cells, the T cells, and it brings them together. And in the clinical trials, we found a response rate of about 60%, and patients responded for about 11 months. But it's really important to find out how this drug works in real-life patients. And so what we did was that we teamed up across Europe and collected data for patients who were treated outside of clinical trials across 8 European countries. So we looked at about 130 patients, and what was important about this group of patients was that 60% of these patients wouldn't have been eligible for the clinical trial for various different reasons, namely because their blood results might not have met the parameters, but also they've already received one of these BCMA-targeted treatments, such as belantamab mafodotin, or maybe a CAR T-cell in the past, and those patients couldn't have got on the clinical trial. Essentially what we found was that overall response rate was about 55%, but if you remove the prior BCMA patients, so the patients who'd already had the BCMA treatment, it goes up to 65%. We found that patients respond on average for about 12 to 18 months, and the durability of the response was over 20 months, with patients living for over 2 years. So actually that data bodes very well compared to the clinical trial data, because as I said at the beginning, 60% of these patients would not have been eligible for the clinical trial to begin with. So it's really reassuring that when we're treating people in the real world outside of clinical trials, that we're getting quite strong results. Thank you.